Well, every expecting mom hopes and prays for a healthy baby and healthy delivery. But for some, delivering a baby can be far more dangerous.
Yeah, according to the CDC, black moms are up to 3 times more likely to die from pregnancy-related causes than white moms. They're also twice as likely to suffer from severe complications during pregnancy and birth. And News 5's Renee Skinner spoke to some local doctors about the factors that are driving these startling statistics.
That's right, Bree, Ira, the big question here is why. Medical experts across the country have known about this disparity for some time now, but new research is showing that this problem doesn't just boil down to the differences in the overall health care of women. Researchers found that women of color had a significantly higher risk of developing life-threatening birth complications than white women, even in the same hospital. The data also found that black women were more likely to suffer from complications like seizures, blood clots, and hemorrhages. You're probably thinking by now, does health insurance play a role? What about the economic status and other outside factors? Well, healthcare officials with the Department of Health and Human Services and the CDC both did the research, and they found those factors had little to no impact, which they admit surprised them.
Even when you account for those factors and also account for other factors such as education and income, the risk to black women is still significantly higher. American College of Obstetricians and Gynecologists recently came out with a statement stating that racial and cultural bias can play a role in healthcare outcomes.
Now, that was Dr. Marlisa Moore. She is an obstetrician at UC Health. Dr. Moore went on to say doctors and policymakers need to think about this problem in a different way. They need to consider whether factors like structural racism, implicit bias, and doctor-patient communication problems are putting the lives of women of color on the line. Meaning, are there different care patterns? Are we using the same quality and safety tools for women in the same way? Well, that idea has been gaining traction. The next question becomes, how do you overcome cultural and racial bias? Well, women can be advocates for one another no matter the ethnicity. Dr. Moore says, visit your obstetrician with a friend if you think you aren't being heard. Then ask questions. Speak up for yourself when you have concerns about your health or your baby's health. Ira, back to you.